Embolic protections are devices which are specifically designed to protect the brain during cardiovascular intervention, and they have been mainly developed during the era of transcatheter aortic valve implantation. So they're designed to protect the brain and against embolic showers or debris, which is usually liberated during cardiovascular interventions. The significance of stroke or embolic debris that is liberated during TAVR procedures is actually not new to us. So it started very early when we had an average stroke rate of above 5% in the early stages of TAVR, and it didn't really decline over the last years. So there is a significant concern of stroke during these interventions. Protembo is a new device that is specifically designed to deflect embolic debris by covering all three vessels, which are usually distributing the debris to the brain, and it's introduced from the left radial artery. Deflection over capturing has been a debate over a long time, and the ease of use is actually, I think, the driving force to go more into the right direction of deflection, because to place a shield into the aortic arch is usually easier than introducing a basket or something that is collecting debris from the circulation. There is a significant problem with any kind of intervention in the cardiovascular system. This is applicable for surgery, for LA occlusion, for mitral clipping, for TEVAR procedures. So anytime we are putting catheters or needles or scalpels into the patients, we do have to expect that we have embolic showers to the brain. So I think this is something that is not new to us, but with the new technologies which are now on the horizon, I think we have some tools in our hands where we can actually protect the brains of these patients. So the optimal device designed for embolic protection devices clearly has one thing that has to be the most important thing, and this is ease of use. We cannot afford to have very complicated devices interfering with the TAVR devices, so they need to be easy to implant into the patient, and they need to be easy to remove from the patient's circulation, and they should be, of course, low profile. The Protembo device is actually the lowest pore size of the current available or the current tested embolic protection devices. And with the 60 micron pore size of the Protembo, this is by far the lowest number compared to the other devices. So with Protembo, I do believe that this is actually a very promising design because it covers the entire arch with all three supraaortic vessels. So it's a full protection device. And due to the fact that it has the lowest pore size, I do think that there is a high potential that we have even less embolic burden to the brain. In addition to that, the Protembo device is also heparin coated, so it is also less thrombogenic than other TAVR, than other protection devices. So I also do think that this is promising, but there is no proof of this concept. We have to test it in first in human studies and then in larger registries to see if this device is really working.